Good morning, Dr. Diana. Welcome back to Agenda.
Good morning, Sita, and good morning to all of your viewers. It's nice to have me back here and have this opportunity to continue our conversation from the last time.
Okay, now last time you came in as general manager, I believe, of Roche, and then after that, also president of PHAP, the Pharmaceutical Association of the Philippines, and now you're one of the board of directors of the European Chamber of Commerce. How do how do you balance all of that? I mean, first, how has life been being the top honcho of Roche?
Well, it isn't a great opportunity. It is definitely a privilege to be of service, not only of Roche but also in these two important organizations, PHAP and of course the European Chamber of Commerce of the Philippines. And you asked, how's the journey been so far? It has been very fulfilling. Roche a few years ago, even at the time of the pandemic, we began our transformation process or our transformation journey, changing our ways of working to be more agile, less hierarchical, more collaborative, and focusing how we can deliver the greatest value and the most meaningful difference to our customers, patients, and society. So I think that has been, I would say, it's fulfilling, but it's also challenging. And I think there you get a lot of fulfillment in terms of seeing the impact that it has in terms of our healthcare, but also in the satisfaction of our teams and our people. And you mentioned the balance, so it is a tricky, it's a tricky thing to be able to balance the three. But I think each society and each organization has its important role to play. But I think there are three things that is very common in Roche, in PHAP and ECCP, and that's actually to make a huge impact to the society, and for economic growth and also for the benefit of the patients.
Okay, now what about the other two roles? You're president of PHAP, and it's one thing to lead a major pharmaceutical corporation such as Roche, but to be the president of I don't know how many members you have. You must have 50, 100 members, all in the pharmaceutical industry. How do you navigate that field?
So it starts with that purpose, as I mentioned earlier, because I think in those two associations, primarily let's say with PHAP, it's really transforming healthcare, bringing research and innovation that saves lives to Filipinos. And then you have, of course, the European Chamber of Commerce, which actually has the goal to strengthen and improve the connections between the Philippines and, of course, the European Union to actually grow the economy. But one important thing to actually grow the economy is actually enable and transform our healthcare system. In a recent study published or shared by the PHAP through our Power of Innovation report, it actually says there that for every peso spent or for every investment in healthcare by the industry, by the pharmaceutical industry, it actually grows the economy by 2.15 times. So, and of course, apart from the fact that it was also mentioned earlier that you actually are able to reach more Filipinos, giving better access faster to healthcare, and also improve the legislations. To bring life-saving innovations in our country, you need to have a multi-sectoral approach. We need to have a community approach, and of course, in making that conducive environment, the policies and regulations will allow for innovation to thrive, and of course, for this better collaboration among different economies.
Uh, I'm just wondering because you mentioned the word innovation. Now, I got a chance to see that report published by the PHAP, where it highlighted the major contributions of the association and its members during the pandemic. Now, what other innovative solutions are on the pipeline, or have you launched to speed things up?
So number one, I think, is ensuring that we also not only deliver on innovative products, but by the way, Tito, now that you ask, in the last 5 years, there have been more than 575 new drugs that were introduced and registered here in the Philippines. And also for the past 2 years, there have been more than 150 clinical trials conducted in our country. And I think what enabled that is, again, not only the innovative projects, molecules, but also the innovative solutions that come with it. And one of it is actually innovative partnerships. I think in the past couple of years, we've managed to improve public-private partnerships. That has been very critical in the success of the introduction of innovation. And I think at the same time, at the national level, recently we have also introduced a lot of collaboration among the local government units, which actually initiated, capability building and also initiation of, I would say, medicine access schemes at the local government unit level, among other things. And also, I think what's also important is these discussions to actually ask, especially in the implementation of universal healthcare law or the cancer law in the Philippines, how ready is the local government units? What does it take to actually implement these laws, and what support do they need? So these dialogues and conversations are happening, and we do have a lot of pilot programs. One of them is actually the one that we're doing, Mission Leapfrog Project in Tacloban City, wherein we try to impact women's health, specifically in breast and cervical cancer, specifically for our DepEd teachers. So what's innovative about that is we bring different stakeholders together, both from the private and the public sector, but we also try to understand what are the different gaps in providing early screening, early detection funding for our teachers, for our DepEd teachers, and to learn from that experiment or pilot program, and hopefully we can also implement that program at the national level. And also, just to add, we have this partnership with PLDT Enterprise. We call it Project ECHO. So it is actually, ECHO stands for the Extension for Community and Healthcare Outcomes. So we did this partnership in Samal, Bataan and Guagua, Pampanga. So we did capability building for the barangay health workers. But during the time of the pandemic, face-to-face could not be feasible. So an innovative thing that we did is, again, with the support of the PLDT Enterprise, is to provide connectivity to the barangay health workers so that the teachers and the faculty can actually do lectures and training with them online.
Wow, that's news to me, because I was wondering earlier. I was asking myself, what's between PLDT, Roche, PHAP? How does a telco giant work with the pharmaceutical industry? So I guess at the end of the day, it's not directly just about medicines, medications, or hospitals. There's also the enabling of communities.
Definitely, Sito. I think that's why it's very inspiring, as you mentioned, to work with different partners, because we don't know that there are actually things that we can contribute in improving the healthcare system, eventually improving our economy, and definitely improving the lives of the Filipinos. And that's why I would like to commend PLDT Enterprise for actually being open to sharing with this vision that we can make an impact, especially at the LGUs and of course in other geographically isolated areas, and also making sure that the standard of care, hopefully, when you are a farmer or a teacher, let's say in Pampanga or Bataan, you'll also get the same quality of healthcare and access to education, training, and also other support system that you can actually have the same way here in Manila.
And let's not lose of the online consultations. Like, I just recently went for my checkups, and I didn't have to wait for the results. They said, we'll just send it to you, we'll vibrate to you, we'll send it to you on Messenger. And none of that's going to be possible unless you have the stable network of PLDT. Now, speaking of partners, what about the healthcare workers, the healthcare sector? what are you doing in terms of enabling them, or what is Roche doing or PHAP doing to enable our healthcare workers, or to at least bring them into all of this?
Well, definitely in this, in the commitment that we have for the healthcare workers, and of course supporting the ones also supporting our healthcare workers. Number one, data-driven decision making is crucial in serving our patients, and also in ensuring that our doctors, our healthcare workers are updated, with the latest information that we have. So definitely, even at the time of the pandemic, we actually even had more innovative means to reach out to them, provide the latest information. So definitely, digital technology had an important role to play. So, for example, if there are sessions happening that you can't travel to other countries, there's a data readout, what's the latest vaccine, then we are ensuring that, different countries, not only in the Philippines, are able to tune into these latest updates, provide them the latest updates also in the journals. And also at the same time, also speed up, let's say, conduct of clinical trials. It was very tricky during the pandemic that we were able to make the communication lines rather more open during the pandemic as we conduct the clinical trials. And also at the same time, how do we also ensure that we tailor fit these types of updates to the schedule of the people? I think that's what we also learned in the pandemic. You don't have to navigate, the traffic, 2-3 hour traffic, just to be educated or to be able to be connected to people. So that connection is also very important, expanding the network of our healthcare workers, not only in the Philippines or across the Philippines, but also across the world. So we have significantly invested on that. All of our PHAP members have really found, I'd say, creative ways in connecting our healthcare workers to the rest of the world, so that we are not left behind, especially when it comes to the latest information and how do we actually make the standard of care available to all the Filipinos.
Okay, so what else are on the pipeline, digitally speaking? Because now that you're talking about all of these digital solutions, I do know for a fact that it has reduced the stress on healthcare workers, because now they just send the data via the internet, or they just share, In fact, some people are now just taking a photo, not even scanning. They just send the photo and, ayan na, sige, give me the analysis, or even lab tests, etc. So you have online seminars, you have online consultation. What other digital solutions or plans do you have, Dr. Diana?
So right now, I think, as you mentioned, technology now plays a very influential role in improving the overall patient experience. I think aside from the health literacy, education, and consultation, it's really finding out, how we can best or tailor fit the healthcare delivery according to the patient's needs. So aside from the education, I think there is also this, as I mentioned, the dialogue that needs to happen between how can the patients give us feedback, how can the families and the communities give us feedback faster. So data generation is definitely important, because for us to be able to create innovative solutions, we need to have evidence-based decision making. So I think that's very critical. I think there is an important role for us to play in this partnership, especially in generating disease registries in the country. I think that's super important. It's coming up, but it's not only for us, but it's also for our country. In the future, it also helps us in planning our budgets. When there is the most up-to-date data that's available, that's going to be made available through technology. And also, if we're able to have interactions, well, some of the people are experiencing already in terms of I would say, the chat GPT, but artificial intelligence. It's also coming up, in the future. How can we have more of these faster interactions? Basically, the waiting time, because right now there is, as you mentioned, it used to be like there's long lines, significant waiting times, not only to seek consult, get results, but also to seek the support that's out there. So we also want to use technology to help patients patients navigate the complexity of our healthcare system. Because sometimes, even though the innovation is already there, the challenge is the barriers. So where do I get the support? Where can I have the information that I need? What are the funding services that are available for me? Which hospital or which clinic serves these kinds of services? So the navigation piece is also something that's coming up. And actually, we already have an existing partnership as well with PLDT in providing our helpline. So right now, Roche provides a patient helpline using PLDT platform, which is again an information hotline, and that we developed actually together with patient advocacy groups. So it provides patients and caregivers access to information on diseases and healthcare services at no cost.
Well, that's going to be fantastic because I do remember that you and your organization partners are quite interested or concerned about primary health care, plus the fact that in 2024, things will shift. A lot of the budget will be in the hands of local government units. But the challenge is, while we're shifting more money to local government units, they can't have a change of address. They're scattered all over the place. And the only way to link them, connect them, is through PLDT, through this network. Is there anything in the plans in terms of, AI-driven primary healthcare? Because, primary healthcare is, hey, get the temperature, give me a picture of the eye or the ear, etc. Is that something that you guys are studying right now?
Definitely, Chito. It's something that we would want for every Filipino. As I mentioned, we're more than we're a lot of thousand islands in the Philippines, and right now the challenge is how a farmer or a fisher folk can actually have the fastest access to innovation. But also at the same time, before I go to the AI, we also want our policymakers definitely to be aligned with this vision in implementing, to your point, a program, a healthcare program that is actually conducive for this innovation or even AI to thrive. Because sometimes the challenge is that we are so fast in our innovation, but then the environment is not conducive. It's sometimes even restrictive. So I think that's also very important for that to happen, and also have a provision for an easier public-private partnership to happen. Because when it comes to AI, I think some of the laws and our regulations are also not updated. And we want to continue to safeguard the patient's welfare. But also, how do you find the right balance? I think that has been clearly demonstrated in the pandemic. This open communication, the agility that we did, the resilience that we had in terms of communication, dialogues, and the laws that were there that allowed for these innovations and partnerships to happen. So yes, in the future, we want to see more of that, the artificial intelligence. Of course, AI will never substitute human connection, but it will help us accelerate the delivery of healthcare closer to where the patients and the families are.
Okay, well, my final question is, and it might be a trick question. My concern with young, talented professionals such as yourself is that they only get to stay in a particular situation for a few years, and then they're either promoted or they're attracted to something else. But what are your plans? What's your vision? And what sort of a mark would you like to leave in the country, in the healthcare environment?
Well, Sito, my dream is actually right now I'm so proud that I've been given this opportunity, as you mentioned, to be able to lead the organization, being the first female and Filipino president of the Pharmaceutical and Healthcare Association of the Philippines, and also at the same time to be the first Filipino citizen who's the general manager of Roche Philippines is already a tremendous, I would say, honor. And of course, the legacy that I like to leave first as a leader is to be able to inspire more girls, and the young people, that it can be done. Sometimes in the way we dream in our careers, we see that there's a lot. It seems to be that we feel that there are a lot of roadblocks. I think it's actually inspiring them to think more of the possibilities, focus on what we can offer, focusing on our purpose rather than the things that we don't have. In terms of the legacy that I would like to leave, I envision our country, the Philippines, to have a fully funded healthcare system, wherein the last thing that the patient should worry about is when going to a hospital or having a medical treatment is the cost. Right? I want the patients to feel that they are fully supported and that they can easily navigate our healthcare system. Right now, we are, every type of disease has a catastrophic impact in our finances. And unfortunately, a lot of Filipinos have to decide, should I just give up so that my family can live? I long for, that day to happen that, when you are sick, you don't have to worry. Having been a patient myself, I also had a difficult time finding the right support. And I hope that one day that's the legacy that I will leave, not only myself, but also the other healthcare leaders from the private sector, from the public sector, that together we will be able to unite. Finally, we will have this alignment and partnership that will enable a better future for the Filipinos.
May your dreams and goals come true. And for the young girls, the young ladies, concentrate on the goal, not the gender. Thank you very much, Dr. Diana Edralin, and please keep us posted on future activities and plans, because we're behind you here on Agenda. Thank you very much.
Maraming salamat, Sito, at maraming salamat po sa inyong lahat.